Someone in the United States has a heart attack every 40 seconds. The good news is that over 90% of heart attack patients who reach the hospital survive, thanks to improved treatments. But afterward, they may be left with an uneasy feeling. It happened once. Could it happen again? Unfortunately, the answer is yes. Heart attack survivors face a higher risk of a second heart attack. They also have a higher risk of a stroke. Surprised? Well, maybe it wouldn't be surprising if we called stroke by its other name, a brain attack. A heart attack and an ischemic stroke are similar events. Both occur because of blockage in a blood vessel.
So a heart attack very often means hardening of the arteries, atherosclerosis in the blood vessels of the heart. That disease process, atherosclerosis, is not necessarily only localized for the heart. And so if you're at risk that you've had a blockage in your heart, then we worry at some point could it be one in your neck that poses a risk of a stroke. There's a risk it can be in your belly for an aneurysm in your belly. There's a risk that it can be in your legs for blockages in your legs. So the word atherosclerosis, hardening of the arteries, blood vessels in the heart are very small. So the heart is often the highest risk for getting blockages and can be the most life-threatening. However, any of the major blood vessels in the body, particularly the brain, the belly, the legs, are also at risk if you have blockages. We don't worry isolated about the heart. We worry is the risk of a future stroke, risk of blockages in the legs, if somebody's had a heart attack or a stent in the heart.
A heart attack can also trigger a cascade of events that then set the stage for a stroke. About 3 to 4% of heart attack survivors suffer a stroke caused by a traveling blood clot, known as a cardioembolic stroke. In this case, that blood clot is created in the aftermath of the heart attack.
First, the most common thing is that with a heart attack, that can trigger irregular heartbeats. And one of the irregular heartbeats that can occur after a heart attack is atrial fibrillation, the irregular pulse where there's no regularity to the rhythm. And that can contribute to little microscopic clots. And if those clots break off, that can contribute to the risk of a stroke. Not everybody with a heart attack has atrial fibrillation, a small, modest percentage. But if you do develop atrial fibrillation and irregular pulse from a heart attack, then that can increase the risk of a stroke. Also, if the heart attack is very large and there's a big area of the heart that's not moving well, the blood can pool in that part of the heart. And by not moving thoroughly, the heart not being vigorous, the blood sitting there and pooling, you might understand that that can lead to a little localized clot. And that also can pose a risk of embolizing or breaking loose and going elsewhere in the body, where we mostly worry if it goes to the brain and poses a risk of a stroke.
Stroke is 2 to 3 times higher for a heart attack survivor than the general population in the first 3 years following a heart attack. The risk is highest in the first 30 days after a heart attack.
The risks of embolism, the risk of atrial fibrillation occurring after a heart attack, the main trauma of the heart attack is the early days, the early weeks. Once the heart starts healing, weeks and months later, the complication rates go dramatically lower. So the increased risk of most complications, including the risks of strokes, are in the early days, the early weeks, particularly the first month or so after a heart attack. And that's when patients are monitored most closely.
Knowing the elevated risk of stroke after heart attack changes how we monitor patients during recovery.
So the ability to use modern blood thinners to do a better job to prevent strokes has led to the increased awareness that atrial fibrillation and irregular pulse is something we should recognize, something we should treat, something that can pose a risk of a stroke, and is one of the biggest previously not well recognized things that can make a difference to reduce strokes throughout the world.
No one wants to have a heart attack, and certainly no one wants to face both a heart attack and a stroke. But thanks to improved treatments and awareness, prognosis has never been better. Prevention helps. The rate of first-time heart attacks has decreased nearly 50% in the last 25 years. If you prevent the heart attack, then you prevent the circumstances that could cause a stroke. Keep your cardiovascular system strong with a heart-healthy diet, moderate exercise, and appropriate medical treatments. And if you ever feel the telltale signs of a heart attack, get to a hospital as quick as you can. I'm Dr. Allison Suarez, and you're watching the eHealth Network. See you next time.